right, hello everyone. Today is Monday, August 2nd. I'm Rendi Murphree, epidemiologist and Director of Disease Surveillance at the Mobile County Health Department, here to give you our Monday update on the impact of the COVID-19 epidemic on Mobile County residents. So usually we start with some worldwide numbers and it just keeps going up and up and up. So worldwide, more than 18 million cases of COVID-19 disease with just over 690,000 deaths. In the United States, nearing 4.7 million cases of COVID with almost 155,000 deaths. And in Alabama this morning, approaching 90,000 cases of COVID with 1,580 deaths. Usually by this time, on a Monday, we would have released our daily report and also our weekly expanded report of COVID cases in Mobile County, but we've had a slight delay today. We hope to get those reports out in the next hour to hour and a half, so those of you who need it for the evening news will have access to it. But today we will be reporting 9,219 cases of COVID-19 among Mobile County residents. 92 were added yesterday. And also we are reporting on 198 people who have died with COVID disease today. From Ames data, you will see that our daily report, as I've been promising, includes the cumulative number of people hospitalized in Mobile County hospitals with COVID-19. That number sits at 1,376. Remember, this is a cumulative number since we first began recording, and that piece of information includes Mobile County residents, but also anyone who is hospitalized for COVID in a Mobile County hospital. So it will include people who live in other jurisdictions but were hospitalized here. We again saw a dramatic increase in the number of cases reported for the week ending August 1st, and many of you noticed on the weekend that we added an alarmingly large number of COVID cases on Friday and Saturday, and I want to try to explain that if I can. So on Friday, July 31st, 398 cases of COVID were reported, and on Saturday, August 1st, 545 cases of COVID-19 were reported. And this was due to something that had been queuing up behind the scenes in our surveillance system, that when it was brought to our attention, Mobile County investigators, along with a team from the Alabama Department of Public Health, worked together to recognize and process manually around 800 to 1,000 laboratory results that had not processed automatically by ALNBS, the state surveillance system. So when this was recognized and brought to our attention, a team of about 6 to 8 investigators worked, Friday night, over the weekend, Saturday and Sunday, to manually process nearly 1,000 laboratory results that had not been automatically processed in ALNBS. And that is the reason that those numbers look so high on Friday and Saturday. Most of the lab results were for tests that were done in the early weeks of July. So starting, around July 7th, 8th, or 9th, and leading up until Friday. So I'm very happy to say that manual process has been cleared out of an abundance of overtime and collaboration between Mobile County Health Department and the State Health Department, and we really appreciate that ongoing collaboration. I want to just bring your attention to something. When you do see our expanded report, take a look at the chart. I think it's number 8, where we show the number of laboratory results by positive and negative. And this is by specimen collection date, not by the report date. So the ones that we processed on Friday and Saturday, because that was the first time someone had touched them in the system, they came across as appearing to have been reported to us on Friday and Saturday. But when you take a look at the data by specimen collection date, you can see that most of those cases were spread in previous weeks. So they were lab tests that had been performed and reported to patients earlier in July. It's just that the report to public health is artificially skewed because of that manual processing that we had to go in and do some work on. And things like this will continue to happen. We have had other situations where, you know, an automated process maybe failed overnight or didn't work exactly the way it was supposed to or intended to. And when those things are, when we catch those things or they're brought to our attention, we try to get them, to get the fix implemented as quickly as possible, and then do any manual processing of those data that we have to. And there will continue to be changes to the way we are conducting surveillance for COVID-19 in the state of Alabama, because again, the system is overwhelmed with the large number of laboratory positives that are coming from around the county. We're still in an extremely high level of community-based transmission right now, so we still need you to please continue social distancing, covering your cough, washing your hands, staying at home if you're sick, and wearing your cloth face covering. When we look closer at the data, I know it's hard to tell from this, you know, aberration that occurred on Friday and Saturday, but when we look closely at the data, it appears as if we had fewer COVID cases reported last week than we did the week before. And that is an early hopeful sign that the mask ordinance, that increasing compliance with the mask ordinance may be actually having the intended effect. And again, sometimes it's just not that apparent to us because of the way that the laboratory data are reported. So look later today for both the daily report and the expanded update report. Then if you have questions about that, I'll answer them on Friday. Let me see. Let me just mention, one of the other indicators that we look at, other than just the number of cases that are happening every day, are the percent positive tests that we have among all laboratory tests. It has been quite high over the past 5 or 6 weeks. It is still sitting around 17%, but that is lower than it has been in previous weeks. So we will continue to keep an eye on that number. All right, let's move over to some questions here. The first question of the day is about a therapy, and we have a new pharmacoepidemiologist who came to work with us a couple of weeks ago, Dr. Scott Chavers. We are very pleased to have him join our COVID response team and our communicable disease investigation and outbreaks team. So I'm going to ask Scott to come up and answer this question. Read the question.
Okay. Thank you, Dr. Murphree. So we did have a media question that came in that was asking about a new therapeutic called Mchd. And the question went on to ask if it was being used in Mobile County. So I'll just give you a little bit of information about Mchd. It is a synthetic drug that is a form of vasoactive intestinal polypeptide. And by the name of that, you would think that it's only has activity in the gut. That's not quite true. It does have activity in the lungs, and it's being investigated for treatment of respiratory failure among COVID-19 patients. So it is not targeting the virus; it's targeting the symptoms of COVID-19. And the way the drug works is it inhibits the pro-inflammatory cytokines that are in the lungs. It also protects alveolar type 2 cells. So I need to stress that although this drug is in clinical trials, it has not been approved to date. So there is no scientific data showing the effectiveness and efficacy of Mchd. I think what has probably garnered the attention is that the FDA just recently granted Mchd expanded access, and what that means is that it can be used in certain instances where patients have failed therapy and they are not eligible to be included in the phase 2, phase 3 trials. And that includes pregnant women, which are often not included in our phase 2, phase 3 trials. If you'd like to get information on drug trials, whether that's related to COVID-19 or in particular Mchd, you can go to the clinicaltrials.gov website and you can search either by the drug or the indication, and it will give you the sites in which the clinical trials are being undertaken. As of today, Mchd is not being studied in Mobile. The sites that are being included are in California, Miami, Florida, Kentucky, and there's some additional international sites. So thank you very much.
Oh, Scott, I think you've got my notes. So thank you. All right. So thank you, Dr. Chavers, and welcome again to the Mobile County Health Department. We're glad you're here to help us continue to battle. All right, so some more questions from the media and from Facebook. Lots of people asking about the increase in the number of cases. So I hope that I've explained that adequately, that most of it was a surveillance aberration, so an excessive number of cases added due to a backlog of manual processing of laboratory results that had not automatically processed through our state surveillance system. Let's see, most of these are about the increase. We're continuing to address your complaints about different locations not adhering to the Safer at Home order, the mask ordinance, or not adhering to things like reducing the amount of people who are dining in, those sorts of things. So if you continue to send us those through our iscomplaints@mchd.org email address, we will continue to do to make those calls and to contact those folks who maybe just need some additional education and information on the requirements. So mostly, someone asked if you're quarantined at home for contact precautions and develop symptoms, who should individuals contact to let them know? MCHD, their primary provider, or both. So if you are at home for 14 days because you have been exposed to someone who has tested positive for COVID-19, if you develop symptoms compatible with COVID, you need to call your healthcare provider. You don't have to call the health department, but call your healthcare provider and let them know that they're having symptoms. If you're able to manage your symptoms at home, this is what should happen. This is what we've been saying from very early on, that those of you who have mild illness or have illness that can be managed at home, please do so. If you are in communication with the health department, please, let one of our investigators know that you have symptoms, and they will make sure to get you marked as a COVID case in our system. Someone asked me about a very large box store, grocery chain in the Tillman's Corner area that closed over the weekend due to coronavirus. Was I aware of it, and do we know how many infections have been associated with that event? And I don't have any more information than you or social media does at this point. That's my Walmart too, so I read that with great interest on social media, and am glad that if they felt like they had enough of an exposure to close and disinfect, I'm very happy that they did that. But again, just remember, wear your face covering when you're in those locations. And then lastly, I just wanted to remind you of the state health order that was amended on July 19th that extends wearing a face covering or a mask for everyone through the end of August. So through August 31st. And again, anyone who has had a positive test must isolate at home for 10 days. and at least the last 24 hours has to be symptom-free. So again, that's 10 days if you've tested positive for COVID. If you have been exposed to someone who tested positive or had symptoms of COVID, you should stay home for 14 days. There is no recommendation for testing to return to work or return to school, and in fact, we're asking you not to get tested to return to work because we need to conserve valuable testing resources for those who, where it's needed most, congregate settings, hospitals, those sorts of things. So again, if you are COVID positive, it's 10 days. If you've been exposed, it's 14 days, and no negative test gets you out of your 14 days or your 10 days. So no test-based strategy any longer for lifting isolation or quarantine. And please, if the businesses and business owners and managers and supervisors would please hear me loud and clear, testing is not recommended for returning to work. Once someone has served their 10 or 14 days, they are free to move about the community with confidence that they are not spreading COVID. So with that, I will end today. I believe we have a Wellness Wednesday segment on Wednesday that will air, and then we'll be back with you on Friday at 2:30 with our COVID update. Thank you and have a great week.